questions?
Yeah.
Sure.
I'll probably got this around the wrong way, but in the US, for example, as I understand it, healthcare costs are continuing to go up and government expenditure on healthcare is continuing to go up as well. The point you saying earlier that if the government contribution to healthcare went up, then that tended to reduce total healthcare costs.
Sorry, there should have been a qualification when the government expenditure through a public hospital. Because here in the US, the government just writes checks, very little control. So the patient goes to a hospital provides them the service, together they send the bill to the government. For the poor people and the aged in the US are, through Medicaid. So that's so that way it's easy to detect.
Currently, the government of Kazakhstan is implementing a market-driven reform in the healthcare by providing a choice for customers, for citizens, to select polyclinic and hospital, and if they so they're not linked to the residents as they are now. So if the citizens would select better quality polyclinics and hospitals, these hospitals would get more funding from the public sector. And this, the government thinks that it will encourage competition between polyclinics and hospitals and improve their quality of services. Do you think that there is a risk in terms of the market failure in this? It will happen.
Yeah, this is a perfect case where you need incentives and control. You definitely need incentives for doctors to look after their patients. Because it's possible right now that the doc clinic is supposed to open at 8 o'clock, you go at 9 o'clock, there's no doctor. Possible, I don't know. How do you make sure that they actually open at 7 in the morning? They open at 7 to 9 in the morning before people go to work. How to make sure? So, because if your doctor, if your local area opens from 9 to 5, this basically means you can't go to them. Unless you're very, very sick. Then you want people to go when they're just slightly sick. But then on the other hand, but the control has to be that you don't over-compete and start smiling a lot and telling your patients that we will give you free medicine, we'll sign a lot of bills for you. Each time you don't want to go to work, please come over and we will give you a bag full of medicine and a medical certificate for not going to work. So it's competition working very well. So you need a control. But in Kazakhstan, they have already done that, I believe. And they have patient system. Right? So the government pays only a fixed amount. They are aware of that. But I'm told that they circumvent it by charging extra, I don't know the details, but there are ways that they're circumventing it. The government, for its part, is aware of the, so it's trying to do the right thing overall. They just, I don't know enough about the details. How, because you really do need incentives and controls. Because if you have a totally bureaucratic system, as they used to have, and then there is no customer has no control over the provider. And you do want customers to have some control over the provider. But you also need the government to have control over the provider.
We also have now have some system quotas. For example, every year issues certain quotas, for example, for open heart surgery patients or any other service that the government will provide for them that's maybe in the budget.
All government provided systems have a quota. Actually, all systems have a quota. A market has a quota by ability to pay. Don't have money, you can't get a healthcare. So that's really a quota. It's, limit is reached when people, the last person who cannot afford it.
But they don't cover.
But the market, but the government has a supply quota. And so in a market system, it's a demand quota. It's reached the moment the last person can afford it. And the government quota, so you have 100 places, and if 107 people have open heart surgery, so 7 people won't get it. But if you're 140 people who need heart surgery, 40 people won't get it. In a free market, this won't happen, right? Like, whoever can afford it can get it. And conversely, those who can't afford it won't get it.
Well, it's a combination of both. You can still get it for money, but like,
So, yeah, no. You don't have to worry. This is the point. Governments worry too much about people who have money. They can always get healthcare. Nobody has to worry about them. Why do they worry about people who can have? They won't get it here. They will get somewhere else. Yeah, so governments should get their priorities, but then they can. They're thinking about themselves. They're not just thinking about the rich. Which are just the collateral beneficiaries.
But do you think in that case, if government worries too much about the poor, the society pays, right? So it's like socially oriented.
Or you can see the society benefits.
Right. But then, in terms of rich, they shouldn't like pay for all the services from their own pocket as well, because they pay more taxes usually than the poor. Is that?
Well, yeah, if the tax system is progressive, which it usually
Yes.
is not. If the tax system is progressive, then the rich will pay more.
So are they entitled to services as well?
Yeah, absolutely. In fact, for political reasons, you should always give services to the entire population. If we exclude the rich population, then they don't have any political stake in that healthcare system. And if they don't have stake, without the support of the rich, you cannot sustain a policy. You can sustain a policy, at least in the short run, by ignoring the poor, but at no point can you ignore the rich. So you have to include them. They may not get it because they can get it somewhere else. They may not. So in Thailand, everybody is if you ask me, I think Thailand is one of the world's best, not one of the world's, probably the best healthcare system in the developing world. And the key word is developing. And why is it good? Because everybody has a healthcare, but rich people don't use it. System works only because rich people don't use it, because it's a very frugal system. So it provides a minimum level of care to everybody, on demand, without single cent. But it's basic, you have to share a bed with 40 people.
But it's in many countries.
Yes and no. Because you need a very extensive system of controls. So it's not just incentives and controls, how you build it in. And they have been doing this for many, many decades. And taxing to people the next level.
Question about healthcare insurance. Will you say that Kazakhstan should actually have this mandatory system of healthcare? Because they tried to implement that in the 90s, it failed. They're talking about it, re-implementing it now. Not sure whether it will lead. Because like if you have something which is outside of the basic thing that is covered by the government funding, you have to pay. Whereas like in the US, if you don't have medical insurance and you are admitted to the emergency room, they will still treat you. The problem is that they will spread the bill like among everybody else. So everybody else will pay for your treatment, so to speak, if you don't have an insurance. So question, do you say it's a good thing?
No, it's actually, it's one of those things, but it's a good and not so good. If insurance just basically means a third-party passive payer, where there's a pot of money available to the insurance that dishes out to the provider, then it's a very, very bad thing. Because what happens in that system is provider and the patient collude to rip off the insurer. So an insurer, or organizations, if they can be lazy, they will be lazy. So it's the government's job to make sure that the insurer doesn't just sign the bill. Yeah, so if they are insurers, they have to be more subtle about it. And this is what the saddest part of this discussion is. Whether should we have this or that? They don't think about how about having both. So they should have exactly the system that they have now, which is governments provide the money, because money gives you control and leverage. Without the leverage, without spending, you cannot have leverage. And insurance has it, but government should have to check the insurer. If you can't check the insurer, it doesn't have the intention or the capacity, then they should stick with the current arrangement.
Other questions?
Oh, Chris, is just some time. Talk to me about this.
Close to our speaker.
This is for welcoming Chris. Thanks, guys.